Welcome everybody to another episode of Coffee with ADHD Experts. This innovative series brings together some of the most eminent experts in ADHD and mental health in the world. Let me introduce you to Dr. Echavarria Norma. She is a medical doctor in adult psychiatrist, president of ADHD chapter in AAP Argentina, APA International Fellow, and member of the ADHD Federation. And also she's a member of the Hispanic Psychiatry Association. And myself, I'm Eleonora Giusti. I'm PhD, psychologist, vice president of ADHD chapter, AAP in Argentina. I'm a clinical psychologist and family therapy also. I'm a full professor at Palermo University in Buenos Aires and professor of the Association of Neuropsychiatry in Argentina.
I'm honored to introduce today Dr. Lili Hechtman. She's a full tenured professor in the Department of Psychiatry and Pediatrics and Director of Research of Child Psychiatry at McGill University. Dr. Hechtman heads a clinical outpatient psychiatry ADHD department in children and adolescents and various comorbid conditions. Dr. Hechtman has done some of the pioneer research in ADHD. So I'm honored to introduce today to you, Dr. Hechtman, and we will be pleased to listen to your answers and what you have to say to us. Okay. Welcome, Dr. Hechtman.
Well, first of all, I want to commend both of you on this initiative. I think it's a very creative thing to do. And I'm really very flattered that you've included me in this list. So your first question deals with, as a researcher, and I'm a psychiatrist, the physician, a teacher, advocate, and being in this field for a long time, what led you to work in ADHD? So, you know, some of the most important life events occur by accident. And actually, what my journey started when I was an undergraduate student at the university. I was always interested in research, and I followed a career in the psychological research track. So I was in honors psychology, and by fourth year, what we did mainly was to do independent research. And my project had to do with hippocampal lesions in rats and to see how well they retained things, because we had suspicions at the time that the hippocampus was a memory organ in the brain. And so we would damage the hippocampus and then train them and then see what degree of retention they had for the training after the hippocampus was damaged. And then we would sacrifice the animals and see where exactly the lesions were and how they correlated with the abnormalities. And so by the fourth year of university, you were really functioning as an independent researcher. And I got really bitten by the research bug. I loved the process. And probably the hardest year that I had was the first year of medicine, where I felt I regressed to kindergarten level, because all you had to do in the first year of medicine was to memorize everything. There was no discriminatory thought process in the process. You just had to memorize all these things. So I found that very hard. Then what happened, how I got into ADHD. So I think it's important to recognize that first passion for research. Mm-hmm. Then when I got into residency programs, I was going to do a pediatric residency and not a psychiatry residency. And part of the reason was that I began to be very interested in an area called teratology. That is where environmental events or
Nelson.
exposures affect the developing fetus. And by identifying what the environmental event or exposure is, you prevent these fetal abnormalities. And I was very taken with that area of research. And so I decided that I would do pediatrics and I would follow that area of research. However, in my training, we had to do a rotating internship. And the rotating internship, you were on every second night, every second weekend. And so you were on 36 hours straight, and then you had 12 hours off. And in the middle of that, what I did was I had my first child. And that was very difficult because the 12 hours that I was off, it was my turn to take care of the baby, and my husband could sleep. And then, of course, when I worked, he took care of the baby, but I didn't sleep. So I was very tired by the end of that year. And you could do a year of child psychiatry as part of your pediatric training. So I decided that I would do a year of child psychiatry as part of my pediatric training. So when I came to do the year of child psychiatry, I met Dr. Gabriel Weiss. And Dr. Gabriel Weiss was a wonderful, very bright, but very kind and soft-spoken person who is doing research with ADHD, and she was doing long-term follow-up research with her initial patients. And since I had the research bug, I said, I volunteered to help in that research project. So I did my residency in child psychiatry, but I was volunteering to work with her in that research project. And clearly I never left. So I got seduced into child psychiatry, partly by her and partly by the research project, but also by the idea that you could intervene in child psychiatry at a very critical point in this child's development. And you had the family working with you, you often had the school working with you, and you had the development of the child working with you. So your input really changed the trajectory for that child. That was very attractive to me. And so that was one of the reasons why I decided to go into child psychiatry. And it was really working with Dr. Weiss on the long-term follow-up that seduced me into the ADHD area. I don't know if that answers your question.
That's amazing. And you know what? The first book I read when ADHD children grow up,
yes,
was the first book I read when I was seeking for information in adults
well,
with ADHD.
I think that was our first
Gabriel.
synthesis of that long-term follow-up study.
So I do have you in my mind and in my beginnings. So a personal question, because being we all have kids and we are professionals. So it's a very important thing to keep working and keep your passion, even motherhood across every one of us in our lives, right? So I honor that part of you. So in your opinion, what would say, how did your interventions made a difference? I know the answer, but I want you to say it. What were the differences that were made with your interventions, Lili?
You mean after I had children?
No, after you, after all your work in ADHD area, all this research that you've done, all the years you've been working.
How did my intervention make a difference?
How
okay. You know, the thing is this, I think it's a later question that you have in terms of what do I think were my main contributions in terms of research. And I think the long-term follow-up that I did with Dr. Weiss was an important contribution because it was really the first time that we could document that this condition continued through adolescence into adulthood. And we could present a picture of what it was like for these adults as you saw them prospectively over time? Because at the time we started the follow-up, the common belief was that the condition dissipated in adolescence. It was only in childhood and maybe early adolescence, but in adolescence it dissipated. And that came from the observation that your hyperactivity and your impulsivity decreased with age, but they didn't really track the impact of the inattention, which remained a big problem. So I think the long-term follow-up study really laid the scientific groundwork for the diagnosis of ADHD in adulthood. And I think that allowed a lot of adults to be diagnosed and treated. And I think it had an impact on those adult people growing up, but also on parents of child patients who had ADHD. So if you treated the parents, they could really parent their child in a much better way. And I think it got vindicated with the DSM-4 and DSM-5, where the adult diagnosis was really much more better established. So that was an important, I think, contribution.
Thank you. And the second part of the question, this is a very important one for us, because did you find any cultural, gender, or age conditioning and getting involved in this field of ADHD?
Well, you know, Canada is fortunate in some ways, because I think that I think women have, how should I put it? They've gained their position gradually. It hasn't come overnight, and it's come with a lot of hard work. And I think that the strain on women to really function optimally in many areas all at the same time sometimes takes its toll. So, you know, you have to be a super mother, you have to be a super professional, you have to be a super clinician, you have to be a super researcher, and one role does not give you license to do less well in your other roles. So that the demands of all these different roles and to really excel in all of them together is A, totally unrealistic, but B, puts a great strain on the people involved. And in order to succeed, and I have to give credit where credit is due, you have to have a really great support system. So early on, my parents were very supportive in helping care for my children. And my husband has been a great support in terms of, you know, allowing me to have the time and energy and effort to be able to work and do the research and do the clinical work. So the demands are high, the supports are needed, but with the supports, it's doable.
You know, it's a pleasure for me to listen what you're saying, because Lili, when I read the book you wrote with Dr. Gabrielle Weiss and Margaret Weiss, I believe that was involved, was young then, I would say that I found myself as an adult with ADHD, because my kid was ADHD and he was 10, but I succeeded in my career. So what the hell, I wasn't at all one of them. And when I read this and say, wow, you can be an adult with ADHD. So that is an amazing thing. It was for me to just be able to find out about what's going on in after adolescence. So now the third question, Eleonora, I want to do that for you.
What would you say?
Yes. On which step of the
what do you imagine the field would be like in the future? Well, you know, I think that the field of child psychiatry goes through eras of popularity. And I think that there was a time when ADHD was extremely popular and a lot of people went into it and a lot of people worked in it, etc. And it is a very attractive field because we have good diagnostic criteria. We have good, some good studies in terms of treatment efficacies. And the other aspect that is beneficial is that we can work with patients and they can improve and they can function well, both in children, adolescents, and adults, and all of that is important. I think that the other contribution I think our research has made has been in the area of multimodal treatment. You know, we've done some of the original studies. Myself and Dr. Abakoff in New York did some of the original multi-site, it was a 2-site multimodal treatment study. That was really the stepping stone for the very large multi-site multimodal treatment study that the NIMH sponsored. And I think the message in all of these multimodal treatment studies is that medication is not enough. That medication, we kind of joke that pills don't teach skills. So, and that these people need skills, organizational skills, study skills, anger management skills. All these other skills are also needed. And the multimodal treatment studies really made the point that A, you can do multimodal treatment, and B, multimodal treatment does have a very positive effect on outcome. So the long-term follow-up studies gave a picture of what happened over time, but the multimodal treatment study said, look, you can't just treat people with medication. You have to give them other inputs as well. And you also have to make the medication treatment really effective. So that was the other kind of contribution. In terms of where I think the field is going, I think that there probably will have some drug development, and some of it is already in the pipeline, because some of these children have a lot of problems in the morning. So you give the medication at night so it covers the morning. So there are some drug developments, and you have developments that give longer period of coverage as well. So for example, we now have a 16-hour medication that covers for 16 hours. So there are developments in terms of medication issues. But I think the other thing that I would hope would happen would be more studies on the effective treatments that people have and that are being developed and people have developed, and the implementation of those treatments, and more important, not just showing that the treatment is effective, but really that the effect of the treatment is what is needed to make that treatment last, for the treatment effect last for a long period of time. And so we're involved in some of that at the moment. We've done a couple of follow-up studies, and we've documented that if you do follow-up, if you treat somebody very intensively and you get a real benefit, if you just leave it there, that benefit decreases significantly within 10 months and is non-existent by 3 years, okay? However, if you have the benefit and you do monthly follow-ups to reinforce the use of the strategies, to reinforce optimal medication, to do whatever is needed, just with a visit once a month, that treatment gain is maintained for the length of the follow-up. So that we're shifting from what is effective treatment to what maintains treatment gains. And so we're kind of trying to work on what maintains treatment gains. So the two things we're working on at the moment is a follow-up study that will try to distinguish what maintains treatment gains, and also a cognitive behavior therapy intervention for adolescents with ADHD. So that some of those skills we're talking about are taught to them. They have a coach that calls them twice a week to implement the strategies, and hopefully that with follow-up, those gains that they make in the cognitive behavior therapy intervention will be maintained. So I think that where we're going, some development in medication to cover mornings, to cover longer periods of time, etc. Some development in interventions like cognitive behavior therapy and other interventions that teach skills that these people need, and some development in what helps people implement the strategy, but more importantly, what maintains treatment gains. So those are some of the directions I see people going in.
I know what you're saying is so important, because sometimes it's very disappointing for us, because we look how little adherence in treatment adults have, and families get so tired of coming in and out. It's like a revolving door in treatment.
Yeah.
So I would say there are many things to ask you, but you mentioned what we are trying with Eleonora to make people know. It's like integrative treatment means family getting involved, psychoeducational approach, all this cognitive therapy also included for dealing with emotions mostly that were out of ADHD for so long time. But also what we are thinking is, what's your opinion? Because you said coaching. We have Jolly Sleeper Triplet after you come in, and she is like master coach, also training other coaches with ADHD. What do you feel about transition when these adolescents go out home and still are struggling with the symptoms, with all this abuse, misuse and things, when they are on their own with medications or with other recreational drugs? What's your thought about that?
You know, I think that the transitions are kids are vulnerable in transitions, and the transition from elementary to high school is very hard. And in fact, we did a transition study to help with that transition from elementary to high school, because in elementary school, they have just one teacher and one classroom. In high school, they have many teachers and many classrooms, and they need much more organizational skills and study skills and autonomy in the high school setting. So that transition is very critical. I think the other transition, probably even more critical, is the transition when they leave home and go out on their own. And I think that transition is hard. They're exposed to a lot of different temptations, you know, in terms of their peer group and their use of alcohol and their use of other drugs. And they, so I think that one of the things that may be critical is to really try to instill some of these you know, organizational and study skills, and to deal with some of the problems encountered in that transition while they're still in high school. So really to prepare them for that transition. But the other thing is to have the universities or colleges that these people transition into sometimes be much more aware of what's needed, and to you know, provide support both in terms of accommodations academically, but also peer support with perhaps coaches, with perhaps some therapy, with perhaps study groups, with supports that these people could use, which were positive, in order to deal with the challenges. Because these people, when they go to the university, have more challenges. Because of the organizational skills are lacking, because the study skills are sometimes lacking, because they're exposed to a lot of temptations, and it's hard to not address those temptations. So I think they require a lot of support, and I think the universities need to be aware that these people are there and to see what they can do to provide those supports.
Well,
Dr.
Eleonora,
Hechtman, thank you very much. It's
Thank
amazing.
you.
And in these few minutes, what would be your message for the people from South America, for the young doctors and psychologists from our country, our...
Well, you know, I think you're doing a great job. And I think that you're opening up yourselves to what's happening in the world as a large. So it's not that insular. And in many ways, we're all in the same boat together, that we need to each other's support, and we're working with the same types of issues and problems, whether it's in America, in Canada, in South America, all over the world. So I think the commonality of purpose and the commonality of mutual support is really critical.
Well,
Thank you
we're
very
absolutely thankful with you, and you are you really rock, Dr. Hechtman. So thank you very much. It's a pleasure. So someday
it's a pleasure for me too.
Yes,
Take care.
and come to Buenos Aires back and have a cup of tea with us. Okay.
Okay.
After the
Bye.
pandemic.
Yes. Bye. Thank you.